When you listen to that announcement, again, the approval of this antiviral pill, tell us a bit more about your reaction as someone on the front lines. Talk to us about efficacy and the kind of change this might bring about.
Yeah, I mean, this is a very positive first step, right? First, we need Health Canada to approve it. That's fantastic. We've crossed that first step. We also now, of course, need to distribute it to the provinces and have the provinces work out how it's actually going to be administered. As we heard, this is a very promising pill. It has to be used very early after symptom onset. The sooner the better, and really not after 5 days. So you really have to think, how are you going to get this out to people in need? And really have that rapid turnaround time of someone gets symptoms and gets access to care quickly. So we need to have very few barriers to testing and very few barriers to care to really start this, because the clock starts ticking once someone gets infected. I think obviously this is a very promising development, but of course there's still some work that lies ahead. One other important point that I don't think was mentioned enough: the data that we have supporting this medication, this pill, it's actually 2 pills, is we don't have peer-reviewed data yet. So we have great data from the pharmaceutical company, but this is all very early, and I think it would strike more confidence in the general public if we saw peer-reviewed data and more transparency over the data. Remember, the other pill from Merck, the molnupiravir, initially it was billed to be 50% effective in preventing serious illness, hospitalization, and death, and then it went down to 30% when more data became available. This one is thought to be about 89% protective against significant illness, like people landing in hospital or dying if they take the pill very early on. But again, we don't really have access to all the data, and I think we should at least acknowledge that we need peer-reviewed data and more transparency over the data. Having said that, everything we've heard about this pill seems very promising. There's clearly logistical hurdles that lie ahead. It's very smart to have access to the medication to those who really would need it the most, especially early on, and ensure that there's equitable access, especially in communities that are disproportionately impacted and underserviced.
Mm-hmm. And could have a potential impact on the hospitalization numbers, which is crippling right across the country.
Absolutely. I think that was a very good point to really highlight rural communities as well. We often think about individuals with risk factors, but there's communities with risk factors as well. Rural communities and several indigenous communities as well. And I thought that was a very thoughtful and smart. And you can't just think about individual level health. You have to think about population level health as well. So this makes sense. Obviously, with time, we'll get more and more access to this medication. We'll have a better understanding of how well it works. But yeah, I mean, we can't underplay how significant this is. This is a big step forward.